Okay, guys, so we're going to be going over the actual bone markings now for the upper limbs, and we're going to start with the clavicle. So, on the clavicle, remember that the flatter end is the lateral end, and the more round portion is the medial end, okay? So, we can actually name these ends. The medial end is the sternal end of the clavicle, okay? Remember, we still need to say of the, and then what bone we're dealing with. So the sternal end is the medial end, which makes sense because when you are talking about placing it on your body, the sternal end, the medial end, is touching your sternum, okay? And it's actually touching a specific marking, the clavicular notch of the manubrium, okay? Remember that from last class. So we have the sternal end, and then the lateral end is actually called the acromial end, okay? So the acromial end. Now, to know which side is posterior and anterior, you need to look for the conoid tubercle, okay? Conoid tubercle. We learned tubercle, that bone marking word, in last class. Tubercles are bumps, okay? So what we're doing is looking closer to the acromial end, and we're going to be looking for a little bump, okay? And that's kind of what I'm pointing to right here. That's your conoid tubercle, okay? So that conoid tubercle actually needs to be facing posterior. So this would be posterior to my body. This would be anterior to my body, okay? And so it would sit with this, the sternal end medial, the conoid tubercle moving posterior, and the acromial end moving laterally, okay? And that's really everything for the clavicle. So next we're going to do the scapula. All right, so remember that the scapula is already on the posterior side of your body, but the most posterior portion of the scapula is what we call the spine, okay? And that's that large thing right here. So you can see it kind of comes off of the main part, and you can actually kind of grab onto it. That's all the spine of the scapula, okay? At the very end of the spine, you have kind of like this, it looks like a leg with a foot or a golf club or something, okay? So this foot portion, this little extension off of the spine, that's actually called the acromion, okay? So that's what the acromial end articulates with. So the acromial end articulates with the acromion. So you'll see that a lot with the upper limbs, that where the bones articulate, the words are actually very similar. Okay, so the acromion is this extension off of the spine. And then kind of jumping over to the next extension, this is your coracoid process. Coracoid process. So it has an A in there. So you can remember the coracoid process because it's under the acromion, which starts with an A. Okay, and then under both the acromion and the coracoid process, you have this kind of interesting portion of bone. It's smooth and flat and almost concave, so you would think that it's a fossa, but it's actually a cavity. This is called the glenoid cavity. And these three markings create that socket, okay? So the other markings for the scapula are what we call borders. So they're really just the edges of the bone, okay? So you have the superior border, which is obviously the top of it, right? So superior border, this would be the medial border, and then the lateral border is on the side where it forms the socket, right? And remember, the spine is posterior, and all of these guys are lateral. Okay, and that's everything for the scapula. Next, we go to the humerus, all right? So the humerus has a lot of markings, so I'll try to go slow. But first, we're going to start with the head. So that head is that round portion that I was talking about that looks like a ping pong ball cut in half. So that is what touches the socket, okay? So ball and socket, and that's how we are able to move our arms so freely, okay? So the head is up there at the superior portion. Moving inferiorly down the humerus, there is the head, and then there's this bump right here, okay? So this bump is called the greater tubercle. So we know that tubercles are bumps. And it's greater because it's higher than this bump right here. That's the lesser tubercle, okay? So the greater tubercle, then the lesser tubercle, all right? And those are all very close to the head. And we're also on the anterior side of the bone, okay? You are looking at the anterior side of the bone. So that's where those two markings are. Okay. Then we have what's called the anatomical neck. It's basically the ridge going around the head, okay? So just like the little outlining of the head on the humerus, you may see in the book, there's anatomical neck and then a surgical neck. The anatomical neck is up here where the joint would be, and then the surgical neck is down here, more so on the shaft of the humerus. That's where they're actually able to cut. They can't cut up in your shoulder joint. They have to cut lower on the bone, okay? If they were amputating. They don't normally just do that. Okay, so then we come a little bit down the shaft of the bone, and there's this really rough portion, okay? So it is called a tuberosity. All right, so this is your deltoid tuberosity. Now this rough portion of bone on the superior portion of the shaft is there to create a rough surface area for the deltoid muscle to attach to, okay? Just like in pottery or sculpting or whatever, you kind of make it a rough surface so that things can attach more easily. That's what's going on here with this deltoid tuberosity. Okay. Now you're going to move all the way down to the inferior portion of the bone, and there's a lot going on, all right? But I think the first thing that we need to understand and recognize is that the head is facing medially, okay? So that means that everything on this side of the bone is medial. So this guy right here, this guy at the inferior anterior portion of the bone, is facing medially, okay? So medial epicondyle, all right? So that is the name of this marking here. So it's a medial epicondyle. And in true fashion of symmetry, we usually will have a medial and then a lateral marking. So we have the medial epicondyle here that I'm grabbing onto on the medial side. And then there's the lateral epicondyle over here on the lateral side, okay? And remember, we know lateral and medial because we look at the head, and the head has to be medial to make that socket, okay? Okay, so we have medial epicondyle and the lateral epicondyle. Then we have the coronoid fossa. Coronoid fossa is, fossas we know are shallow pits, so we have here this shallow pit moving kind of in the middle of the bone. This right here is the coronoid fossa, all right? And then right next to it, there's another fossa. This is the radial fossa. It's not as concave as the coronoid, but the radial fossa is more so on the lateral side. And that is because, like the radius, it's on the lateral side. So radial means lateral, radial, lateral, radius, lateral, okay? So you have the radial fossa and the coronoid fossa, okay? Now, all the way down here, we have kind of like this little ball right here on the lateral side. That is your capitulum. And then moving more medial on the bone and directly under the coronoid fossa, you have what's called the trochlea, okay? So the trochlea kind of makes like a little V. it comes together like that. And then it's right under the coronoid fossa, okay? So that's the trochlea. And the capitulum, that's all the way on the lateral side. Just remember if you're getting those two markings confused. That's everything on the anterior side. Then we have to flip it to the posterior side, and we have one more marking for the humerus. This is called the olecranon fossa, okay? It's still, it's not so shallow, but it's still a concave pit. All right, so it's still a fossa, and we call it an olecranon. And I like to remember that because it's the only, it makes like a large O, okay? So that olecranon fossa, that O fossa, has to be posterior, okay? And that's the humerus. Then we can move on to the ulna, all right? So remember, we have a U for ulna. Okay, so at the superior portion of the ulna, we have what's called the olecranon process, okay? So it's that same O word, olecranon. Then, of course, we have a notch, where that U is. That is your trochlear notch, And then you have this extension on the other side of the notch. So you have this side of the notch and then this side of the notch, okay? So this extension is the coronoid process. You've also seen another coronoid process that was on the mandible, all right? So if you didn't remember that, maybe review the skull a little bit because the practical is coming up. Okay, so you have the olecranon process, the trochlear notch, and then the coronoid process, okay? Then you can move down the entire shaft and you have that little pointer. Remember, I told you that that pointer had to be facing your medial portion, your medial line of the body, okay? That is actually called the styloid process, all right? And lastly, for the ulna, I believe we have to go to the radial notch. So the radial notch is on the lateral side because radial means lateral. So if the styloid process is your medial marker for the ulna, then that means that this side of the body, or this side of the bone, is medial, and this side is lateral. So we're looking for a radial notch. And that's actually right up here, the superior portion. It's on the lateral side of that superior portion of bone, okay? So it's a nice little dip. That's your radial notch. That's where the radius articulates with the ulna. Okay. Then we have, lastly we have the radius. The radius has like literally nothing going on. It's a super boring bone. It's basically just a stick. So you have the head, which is that skinny portion at the top of the bone. Then you have the neck, which is just basically under it, okay? And then all the way at the inferior portion of the bone, you have this kind of like jagged piece of bone kind of coming to one side. That's coming to the lateral side, and that is your styloid process. So just like with the ulna, it had a styloid process facing medial, the radius has a styloid process facing lateral, okay? And that's kind of how the bones fit together, like that. It's very pretty. Okay, so now I have to show you this really cool thing. I think it's the most awesome part of the whole body of how the bones articulate with one another. It's how your elbow is formed. So remember I had said that when the upper limb bones are articulating, basically the word of one marking on one bone and the word of the other marking on the other bone, it's going to be similar, okay? So hopefully you recognize that with either the acromial end and the acromion, or the radial notch and the radius. But for the elbow, okay, so we're going to look back at the humerus, all right? So we had a coronoid fossa, we have a trochlea, and we have an olecranon fossa. On the ulna, we have an olecranon process, a trochlear notch, and a coronoid process. So that is how the elbow fits in to the ulna, okay? So when we move, the olecranon process comes into the olecranon fossa to articulate. And of course, the trochlea is sitting in the trochlear notch. And when we go like this with our arm, right, the coronoid process goes all the way into the coronoid fossa. Okay, so that is how the elbow works, and I just think that that's the bee's knees. All right, so that's really everything out for the rest of this lab.